So before we jump in, let's warm up that chat. Okay, so let me just access the chat box here. And so where are you watching from tonight? All right, so you can type your city or country in the comments here, and I want you. I want to know. I want to know where our future USRNs are tuning in from. Okay, so we have here. Okay, Tina Cristobal. Okay, so hi Tina, great day. Watching from Riyadh, Saudi Arabia. And we also have here Danielo watching from Canada. All right, so how about the others? You can type your location here in our chat box, right? So how's everyone doing today? All right. Okay. So I see viewers from the Philippines. All right. Okay, yes, from the Philippines. Okay, you can type your location here. Okay, we have here from Middle East. Okay, Tina. Yes, okay. And Canada as well. Thank you so much for being here. Okay, so once you enter here in our Facebook Live, just type your location. Okay, so that I can acknowledge your presence po, no? So, yes, right? So, this is a global NCLEX community and I love it. Okay, so now let's talk about our main topic for tonight, right? Okay, so our topic is all about, your OB or maternal and child health, right? So, the NCLEX spotlight, maternal and child must knows you can't miss. All right, so we will be going through the most trending NCLEX topics in your OB or maternal and child nursing, including I prepared your the fetal heart rate patterns, so the ones that yes, the ones that show up in the NGN style questions, right? Okay, the stages and phases of your labor. Oh my god. Okay, and what to prioritize in postpartum care. And of course, if we still have an ample time, so yes, we will be discussing the high risk conditions like your PIH or your pregnancy induced hypertension, which is a trending topic. Okay, so let me just check the chat box again. Okay, all right. So again, you can type your location here in our chat box so that I can acknowledge your presence. All right, so these are highly tested and always show up in your upcoming NCLEX or an examination. So if you're reviewing for the NCLEX, this is your moment to lock it in, right? Okay, so can you please type ready, ready, ready if you guys are ready? Okay, ready, ready, ready. Are you ready? Okay, so let's start. Okay, very good. So let's start. Okay, sige. Okay, so let's start the session with a foundational concept that every NCLEX test taker should master. Okay, so what is that then? Okay, the fetal heart rate. Okay, the fetal heart rate or the FHR. So when it comes to your prioritization, right? Okay, you cannot afford to miss this. So we have a very important things here. Okay, when it comes to prioritization, we have the mother and the baby, right? Okay, so let's focus on the baby or the fetus. All right. Okay, so let's talk about your fetal heart rate with which is a trending topic. Okay, so question: what is the normal fetal heart rate? Anyone? Okay, you can type your answer here in our chat box. Okay, I'm checking your answers. Okay, what is the normal fetal heart rate? Anyone? Anyone? Mm-hmm. What is the normal fetal heart rate? The fetal heart rate is the normal FHR is anyone? Mm-hmm. All right, so I'm expecting a bit of delay. All right, maybe a bit of delay, but yes, okay, I believe most of you are typing your answers here in our chat box. Okay, just post your answer. What is the normal fetal heart rate? Anyone? All right, type your answer here in our chat box. All right. Okay, all right. So the normal fetal heart rate ranges between, let's use this, 110, and 110. Okay, 160 beats per minute. Very good. 160 beats per minute. Take note of this. Okay, a normal fetal heart rate. Okay, this one is a trending topic. You cannot afford to miss this now. So this is your baseline. So we expect the fetal heart rate to have a moderate variability. So what is that? Okay, what is that then? Okay, so which means that that the heart rate of the baby, okay, naturally fluctuates, okay, around 6, okay, to 25 beats per minute, right? So what does it mean? What is the implication, Tino? So this shows us that the baby's central nervous system is intact and responsive. It is responsive, right? So when we see, okay, accelerations, okay, so we have here the acceleration, so meaning we have an increase in the fetal heart rate, okay? So when we see acceleration, this is a very reassuring sign, okay? So meaning, uy, acceleration is the increase of how many beats per minute din? Okay? I would like to acknowledge the presence of Luz. Hello, Luz. Okay, from Eastern Samar, Philippines. All right. So it's acceleration, okay, in response to a movement, right? And this is a very reassuring sign. Okay, so for at least 15 beats per minute. Okay? For at least 15 beats per minute above the baseline. And lastly, okay, at least 15 seconds. Okay, again, your accelerations usually occur again with fetal movement. Okay, if there's contraction or stimulation, right? And they tell us the baby is an indication that the baby is well oxygenated and neurologically intact. Yes or no? Yes. Right? Next, we also have here your deceleration. Okay, teen, what is your deceleration? Okay, so meaning there is decrease in the fetal heart rate. Okay, and depending on the type, they can be benign or concerning. All right, and when it comes to your deceleration, we have, okay, three main types. Can you still remember your deceleration? Anyone? Okay, a wild guess. Okay, kindly type your answers here in our chat box. Post your answers. Okay, do not be shy, right? Anyone? Okay. Okay, what are the three main types of your decelerations? Hello, Latia from Zambia. Okay, again, question. Okay, what are the three main types of your deceleration? Anyone? Can you still remember? Okay, Joy. Hi, Joy from Zambia. We have your early, right? Okay, what else? Your early deceleration, the late deceleration, and your variable deceleration. Okay, so what are the differences of these decelerations, Teen? Okay, is this life threatening? Is this, something that we need to worry about? Okay, sige. All right, so let's proceed to the four heart rate patterns. Okay, you already know the baseline, which is 110 to 160 beats per minute. All right, so this chart is a classic NCLEX trick. Okay, and it's an absolute must memorize. Okay, you need to memorize this very easy for you to pass the NCLEX now. Okay, you cannot afford to miss this. So, okay, take note of this acronym, the veil chop. Okay, so it helps us identify, okay, the type of deceleration, its cause, and of course it will guide us on what action to take. Yes or no? Yes. Okay, so Tin, what is that veil chop? Okay, what does it mean? Okay, so letter V, okay, V is your variable deceleration. Okay, V stands for the variable deceleration, right? If NCLEX would ask you for the cause, okay, ayan. So we have here letter C for the cause. Caused by, letter C, cord compression. Very good. Cord compression. Take note of this one. All right? Cord compression. And we also have letter E, okay, that stands for early, okay, deceleration. Okay, Tin. Okay, what is the cause? And your early deceleration, okay, is caused by letter H. Okay, your head compression. Take note of this one. Your head compression. Okay? And letter A, what does it mean? Okay, what is your letter A? Letter A is for acceleration. Okay, acceleration. Right? Your acceleration. So meaning, this is a good sign, right? Because yes, letter O stands for, it's okay. All right, it's okay. Meaning it's a good sign. It's a good sign. Yes or no? Yes. Okay. Next, we also have here letter L that stands for late deceleration. Okay. Your late deceleration. Okay, so what is the cause of late deceleration, teen? We have here, okay, an acronym letter P. Letter P stands for your placental insufficiency. Okay, placental insufficiency. Okay, and of course, if you're reading references, that is your utero-placental insufficiency, which is a concern, right? Okay, so when you see these patterns on the fetal monitor, this acronym help you think quickly. Veil chop. Okay, take note of this. Veil chop. Okay, so let's test your knowledge. Okay, okay, question. Okay, you can type your answer here in our chat box, ha? Okay, question. If you see late deceleration on the monitor, what is your first nursing action? Okay, anyone? Type your answer here in our chat box. If you see late deceleration, all right, on the fetal monitor, okay, so what is your first nursing action? Anyone? Okay, I'm checking your answers here in our chat box. Okay, so I've sent an application. Okay, so how about the others? Okay, how about the others? What is your answer here? What is your first nursing action when you see late deceleration? Late deceleration. Huy, there's a placental insufficiency. So meaning, huy, okay, it's very important to focus on okay, oxygenation of the fetus, right? Yes, that's also correct. Okay, how about the others? Okay. Oh, okay. I'm checking for your answers here. Okay. All right. Sige. So we can use this, okay, LION. Okay. We can use this acronym LION. Okay, for the management of your okay decelerations. Okay, your veil chop, yes or no? Yes. So actually, you can also apply this acronym LION, okay, to most of the concept in the medical, okay, surgical nurse, no, in the maternal and child nursing, okay, in your MCN or your OB, no? Okay, you can never go wrong with this one. Okay, so what is that LION? What is that LION? Letter L stands for your, okay, you will position the patient in, okay, you will position the pregnant client in the left side lying position. Okay, left side lying position. Very good. Okay. Position the mother. Very good, Latia. It's very important to position the mother, no? So why? What is the rationale behind this one? Okay, why are we going, okay, to position the mother? Okay, because this one, especially the left side lying position, okay, the left side lying position, okay, this improves the blood flow, okay, to the placenta. Okay, so you can never go wrong with this one. Next, we have here, okay, another acronym, letter I, that stands for, oh yeah, intravenous IV or increase IV fluids. Okay, increase, okay, IV fluids or anything that reflects hydration of the mother. Yes, because this one will help, okay, improve the placental perfusion. Yes or no? You can never go wrong with this one, especially if the topic is OB, right? Okay, if there's bleeding, high risk in pregnancy, you can never go wrong with this one. Yes or no? Yes. Okay, another one, we have letter O. Letter O stands for, anyone? Wild guess? Letter O? Okay. Okay. Oxygen. Okay, ayan. So, administer oxygen. Okay, so usually it's 8 to 10 liters per minute to help oxygenate the fetus, right? And letter N is notify. Notify the HCP, especially if the pattern continues despite, okay, these interventions, okay? So, I would like to highlight this one. Another critical reminder, no? So, if the patient, okay, is receiving for example a pitocin, no? So that's okay, your oxytocin, and you see late decelerations or signs of fetal distress. Okay, the first thing that you need to do is to what? Anyone? Uy, ha? Okay, what is your first action? Okay, again, your patient is receiving pitocin or oxytocin, and you see late deceleration or signs of fetal distress. Okay, so what is your initial action? Okay, or your patient, your pregnant client or patient, okay, is, in a pitocin. Okay, okay, is it, okay, is it important to stop? Yes or no? Yes. So the first thing that you need to do is to stop, okay, the oxytocin infusion immediately. All right, and then follow this lion. You can never go wrong with this one. Yes or no? Yes. Okay, so let me know in the comments. Is this clearer for you now? Okay, okay, clear. Okay, so let me check. Okay, sige nga, let me check. Okay, can you please type lion below if you'll remember this during your NCLEX. Okay, type lion in our chat box. Okay, if you will remember this during your NCLEX, lion, lion, lion. Sige, chat box, type lion. All right, type lion in our chat box. Okay, sige, I'm checking for our chat box here. Type lion. Okay, lion, lion. Okay, no response. Okay, how about the others? Can you please type lion? All right. Okay, type lion in our chat box. Okay, if you will remember this during your NCLEX. Okay, so I will check that later, ha. Okay, now let's talk about another trending topic that you might encounter on your upcoming NCLEX RN examination. Okay, that is your stages of labor. Okay, not just the stages. Very good. Ayan. So we have here response from Marialine. Hello, Marialine. Lion. Okay, so meaning Marialine will remember the lion. Okay, on her upcoming NCLEX RN examination. Very good. Okay. Another one, you cannot afford to miss this. The stages and phases of labor. Okay, what are those in? Oh, yeah, you should know. You should remember the stages. Okay, anyone who can remember the stage one? The stage one of labor, anyone? I'm checking our chat box. Anyone who can remember, okay, the first stage. Okay, first stage, can you still remember? Okay, first stage or the stage one? Okay, so that is your, okay, that is all about your, very good, your cervical dilation. Very good, no? So that is all about your cervical dilatation or dilation. Okay, so cervical dilation and effacement. Okay, and effacement. Remember that, no? And effacement, right? Of course, we're expecting to, that the mother will give birth, right? So, okay, it must be a full cervical dilation of 10 centimeters, right? Okay, so here on the stage, the cervix softens, okay, thins out, and opens now up to, okay, very good, 10 centimeters to prepare for birth. Yes or no? Yes. Okay, so we have here another response from Latia. Okay, lion. Very good. Okay, so how about for the stage 2 of your labor? Okay, by the way, under the stage 1, I would like you to remember this. Under the stage 1, okay, under the stage 1, we have phases. Okay, phases of your labor and delivery. Can you still remember that? Anyone? Then I cannot remember that. Okay, so just discuss. All right, it's okay. It's okay. So under the stage 1, we have here the phases, okay, of your labor. Okay, so remember your lat. Okay, can you still remember your lat? Anyone? No, Tin. No, I cannot remember anything in maternal and child nursing, no? Okay, so lat, okay, under the stage 1, lat stands for latent phase. Okay, the latent phase, the active, and the transition. And the transition phase. Later, okay, we will dive deep, okay, in these phases of your labor. Right? Again, for the stage 1, that is your cervical dilatation or dilation and effacement. Okay? How about for your stage 2? Very good, Wati. I know there's a little bit of delay. All right? Because, yes, okay, I'm receiving responses here in our chat box. Okay, how about for the stage 2? What is the stage 2? Of your labor? Can you still remember? Okay, after, okay, a full cervical dilation, we are expecting that the mother will give birth. That is, okay, very good, delivery of the baby. Okay, delivery of the baby. Okay, delivery of the baby, ha? Okay, take note of that one. Delivery of the baby. Okay, delivery of the baby po, right? So this is the pushing phase, ano? Pushing phase. And of course, it can last minutes to hours po, depending on the mom and the baby. Yes or no? Yes. So after the delivery of the baby, okay, we have here the stage 3. Okay, so what is the stage 3? Okay, so what is the stage 3? Stage 3 is after the baby is delivered. Okay, so this one is the delivery of placenta. Okay, delivery. Okay, delivery of your placenta. Of your placenta. Okay, take note of this one, ha. This one is a trending topic and it's a promise. You might encounter this on your coming NCLEX RN examination. Okay, so the delivery of placenta usually happens. Okay, very good, Marialine. Very good. Okay, so this usually happens, okay, within 5 to 30 minutes after the baby is out. Take note of that one. Previous NCLEX question. Okay, delivery of placenta 5 to 30 minutes after the baby is out. And we have here the stage 4. Okay, so what is the stage for anyone? What is the stage 4? Okay, after the delivery of placenta, our focus is, okay, what is our focus? Our focus is the recovery period or the recovery stage. Very good. Recovery. That is your recovery. Okay. So that is 2 hours. Okay. Until the bleeding stops, or 2 hours postpartum. Okay. 2 hours. Okay. Postpartum. Right. So where we closely monitor, okay, the mother, yes, for any signs of bleeding or complications. Right. Okay. So, NCLEX tip. Okay, so take note of this one, no? So the risk for hemorrhage is highest during, okay, stage 4. Take note of this one. Okay, the risk for hemorrhage is highest, okay, during stage 4 of your labor and delivery. So assessment is, yes, critical here po. Okay? Sige. Again, let me ask you. Okay, let me ask you guys. So what is the normal time frame for placental delivery in stage 3? Can you still remember? Okay, what is the normal time frame po? Okay, for the placental delivery in stage 3. Can you still remember? Okay, so type your answer in the comments. All right? So type your answer in the comments. What is the normal time frame for the placental delivery in stage 3? Can you still remember? Anyone? Sige, let's wait for your answer. Okay, so how many minutes? How many minutes? All right, so, okay, how many minutes? Anyone? All right, so let's check the chat box here. Okay, so let's, okay, very good, Tina. Okay, very good, Marialine. So that is 5 to 30 minutes, no, after the baby is out. That is a previous NCLEX question. All right, very good. Great job. Okay, very good, Latia. 5 to 30 minutes after the baby is delivered or the baby is out. Very good. Okay, we also have your answer from Chrislyn. I think no. Okay, there's a bit of delay. Okay, I don't know what's happening on my internet connection. All right, very good now. Okay, you are already familiar with the stages of labor. Again, let's have a recap. Stage 1, cervical dilatation up to, of course, 10 cm, right? And a stage 2 is the delivery of baby. Stage 3, delivery of placenta. Stage 4 is the recovery stage. And under the stage 1, we have phases. Okay, so LAT, that is your LAT, no? Latent active transition. As simple as that. It's a promise. You might encounter this on your upcoming NCLEX RN examination. Now, yes, you cannot afford to miss this, the phases of labor. Hindi pa tayo tapos. Yes. Okay. Ha? Alright, so this is just the beginning. Okay, it's just the beginning po, no? Okay, so this one is the favorite of your NCLEX, right? So NCLEX will ask you, okay, okay, what to monitor, okay, and of course, how many hours you're going to monitor the patient, something like that. Okay, ayan. So again, we have here your LAT. Okay, it is your latent active transition. Now, let's talk about of your dilation. So meaning, okay, it is in cm. Okay, how are you going to remember this? Okay. Okay, how are you going to remember this? Okay, okay. It's very important when you are, okay, if you are not into memorization, yes, because NCLEX is not about, memorization. NCLEX is not about recall. It's about, prioritizing things, no, under pressure, no. But it's very very important that they stable, right? Okay, you can associate things or you can sing it, something like that. It's up to you, okay, on how you can remember, okay, this values or figures po. Okay, so we have here the sequence LAT, meaning Latin active transition. Think of the dilation 0 to 3, 4 to 7, 8 to 10. Or you can sing it 0 to 3, 4 to 7, 8 to 10, something like that. All right? It's up to you. You can repeat it 10 times, no? Okay, sige. For 28 days, no? Para mapunta sa subconscious mind, yes or no? Yes. No? Okay? All right. Dilation. Okay, it is 0 to 3, 4 to 7, 8 to 10. And let's talk about of the duration. We're talking about the duration of the contraction, no? So it is in seconds po. Seconds, right? So okay, seconds, right? Seconds, right? So think of 20, 40, 60, right? So again, memorize that. 20, 40, 60, and then copy this one. 20 to 40, 40 to 60, and 60 to 90. Take note of this one. Why 90 seconds, no? So, contraction or duration of contraction of more than 90 seconds, or if it's more than 120 seconds, well, that is your uterine hyperstimulation leading to fetal distress. Okay, so no more than 90 seconds. Okay, so it's 60 to 90 seconds, right? So again, it's 20, 40, 60, 20 to 40, 40 to 60, and 60 to 90, right? For the frequency or interval, okay, of the next contraction, ano? So this is, okay, in Tagalog, pagitan po. Okay, ito pong interval sa susunod pong contraction, right? So it is in minutes po. Minutes naman yan, right? Minutes. Okay, minutes, right? So remember these figures? 10 minutes. Okay, 5, 3. 10, 5, 3. 10, 5, 3. Okay, again. Okay, sige. Dilation, 0 to 3, 4 to 7, 8 to 10, 20, 40, 60. 20 to 40, 40 to 60, and 60 to 90. Okay, interval 10, 5, 3. 10, 5, 3. Take note of that one. Alright, so how about for the intensity? So let's talk about the intensity of contraction. If it's in the latent, okay, latent phase, no? Okay, it is mild. Okay, we're expecting that it is mild la. Okay, next, if it's an active phase, no? Active phase, moderate. Okay, moderate yan. And of course, we're expecting a strong contraction if it's in transition phase, right? Okay, so how about the mother? How about the mother teen? Anyone? So we are expecting that during the latent, okay, we're expecting that during the latent phase, the mother is, or you can advise the mother to what? Uy, ha? They can walk around. Ay, mommy, lakad ka muna. Just walk around, no? Okay, lakad-lakad ka muna dyan. Okay, walk around. Okay, advise the mother to walk. Okay, walk. Take note of that one, ha. Okay, so moms are, still chatty and, they're very talkative talaga, so they can walk around. Yes, no. Okay, so it's very, very important to what, okay, monitoring, or later we will tackle about the monitoring, no. Si NCLEX loves to test about this monitoring. But, okay, so let's talk about during the active phase, all right? So the active phase, think of what? Your epidural. So this is when when most patient request, okay, epidural or the administration of epidural. Okay, so this one is a previous NCLEX question. Okay, so what phase of labor, okay, are we expecting to administer epidural? Answer, active. Okay, your active phase, or okay, if you cannot see on the option, okay, the active phase. Okay, so these are the parameters. These are the parameters, 4 to 7. Okay, but it's very, very important to focus on the duration and the interval of the contraction. Okay, because sometimes, okay, it reflects on the active phase, Okay, for the interval and duration, ano? And of course, for the dilation, sometimes it's 3 cm. Okay, but still, it's in the active phase. Right? Next, okay. So we're expecting on the transition phase. Okay, transition phase. What is this? Okay, oh yeah. Okay, this one is the delivery now. Okay, ha. Moms often, feel okay the urge to push because yes, that's the time that the mother will deliver the baby. Delivery. Okay, delivery. Okay. All right. Take note of that one. Take note of that one. Now, let's talk about of the monitoring. Previous NCLEX question, no? NCLEX loves to, okay, ask about the monitoring, no? So, during the latent, okay, it is, oh yeah, okay, monitor the fetal heart rate and at the same time the mother, no? Okay, every how many hours or minutes? Anyone, huy, hi. Okay, okay, 1 hour. Okay, Q, 1 hour po. Okay? If it's in, okay, the active phase, okay, it's Q 30 minutes. And of course, we're expecting that the mother will deliver the baby. Huy, ha? Okay, it's Q 15. Okay, Q 15 minutes, yes or no? And instruct, hoy, that the pushing is every 5 minutes, no? Pushing, okay, every 5 minutes. Yes or no? Yes, you can copy this one. All right. Okay, NCLEX loves to test about these phases of labor, and it's a promise. It's a promise po. Okay, take note of this one, ha. Okay, so the transition phase is the most intense and shortest. Okay, so yes, expect the mother to be what? Uy, the mother is irritable. Okay, nauseated, no, and in severe pain. So that's totally expected. That's totally normal. Okay. Sige. So let me throw this to the crowd. Okay. So in which phase of labor do we usually administer an epidural? Hi, what? In which phase of your labor do we usually administer an epidural po? Okay? Ay, so we have here 3 phases. What phase? Okay, epidural administration is during, okay, right? So type your answers here in our chat box. Okay. Active phase. Very good, Marialine. Very good, Tina. Take note of that, ha? Oh, you have already point. Meron ka ng point, ha? Okay, sige. Very good. Nice. All right. Sige. Next, let's talk about, okay, the 3 big things to assess during the postpartum. And it's a promise. It's a promise, okay? Your maternal and child nursing or your OB, okay, is a trending topic. Aside from your endocrine disorders, your OB, your mental health nursing, when it comes to therapeutic communication, yes, this is a trending topic, especially, okay, what to assess during postpartum, no? Especially they incorporate this on the case study, eh. Yes or no? Can you still remember this? Uy, can you still remember, no, when you gave birth? Okay, what are the 3 big things to assess after giving birth? Anyone? Hi, can you still remember? Can you still remember, my dear nurses? Okay. Okay. Is it important, okay, to assess the uterus or the fundus? Yes or no? Yes or no? Oh, yes or no? Yes. Okay. The first thing you need to assess is the fundus. Okay, fundus. Okay, or the uterus. Okay. Take note of this one, ha. Fundus or uterus. This one is a trending topic. Okay, you cannot afford to miss this. Okay, 18, what are the normal assessment postpartum, no? Okay, so upon assessment of the fundus or the uterus, okay, it should feel what? Uy, it should be what? It should be high. It should feel firm, no? Okay, your fundus, okay, should feel firm and should be in the midline. Take note of this one. A trending case study, no? And of course, right around the umbilicus, no? So, meaning, teen, if the uterus feels what? Soft and boggy. If you encounter this one, huy, soft and boggy. Okay, so, it's already abnormal. The normal, the normal is, it should be firm and in the midline. Okay, if the fundus feels boggy or soft, that means it's not contracting properly. Yes or no? Yes. Okay. What is your first action? Anyone? Okay. I just want to check. Okay. Your insights. Okay. If you encounter a soft and boggy uterus, what is your first action? Anyone, what is your initial action? Okay, previous NCLEX question. Your initial action. Anyone? Okay. All right. So just type your comments here. Okay, type your answers in the comments. Okay, so what is your initial action when you encountered a soft and boggy uterus? Okay. All right. Type your answers here. Okay. Type your answers. Okay. Your first action is what? Okay, massage the fundus. Yes or no? Okay, fundal massage. Fundal, do this fundal massage po or massage the fundus. Yes or no? Yes, okay, that is your first action ha. And if the fundus, very good Latia, rub the fundus or fundal massage, that is correct. Very good. Riza. Hello, Riza. Yes, very good, no? Okay, it is your fundal massage. Anything that reflects to rubbing, massaging, yes, okay. But NCLEX loves to use massage, no? And if the fundus is off, okay, is off to the side, okay? If the fundus, okay, take note of this one. If the fundus is off, okay, or meaning the fundus is not, okay, not in the midline, okay, not in the midline. Okay, fundus is not in the midline. Okay, so what is your action here if the fundus is not in the midline? All right, so meaning, the fundus is off to the side. So it may mean that the bladder is full, no? So anything that reflects, okay, that the mother will void, no? Yes. Okay, NCLEX loves to use catheterization. Okay, insert an indwelling Foley catheter. Yes, anything that reflects that the mother will void, that is the correct action. Okay, ha? Instruct mo. Okay, you need to instruct. Okay, that the mother will void or, okay, insert indwelling Foley catheter. Right? And then afterwards, reassess. Very good, Marialine. Okay, empty the bladder, no? Because it may mean that the bladder is full. That is why it is off, okay, to the side or not in the midline. What is the normal, okay, assessment again? Postpartum, it should be firm and at the midline, right around the umbilicus. Yes or no? Yes. Take note of that one. NCLEX loves to test about this one, especially yes case study. Okay. And what is the problem if there is a soft and boggy uterus? What is that? Okay. What is that? That is your. Wait. That is your story. Okay, starts with letter U. Okay, what condition is that? Soft and boggy uterus. What condition is that? What condition is that? That is your uterine atony. Very good. Your uterine atony. No? Okay. So the previous weeks, no, I have noticed that NCLEX loves to test about uterine atony, especially for the case study. It's a promise, okay? All right? Okay, very good. It's very good, Nini, buen viaje, all right? That is your uterine atony. Again, if the fundus is rising instead of descending, that's a red flag now for postpartum hemorrhage. Next, another big things to assess in postpartum, aside from the fundus or uterus, second one is your, okay, can you still remember your lochia? Can you still remember your lochia? Okay, so your lochia is the vaginal discharge after delivery. Okay, so moderate bleeding should be around 4 to 6 inches on pad in 1 hour, but if you encountered saturation of pads, okay, less than 15 minutes, or the pad is soaked less than 15 minutes, no? So that's excessive. And you need to act fast for what? Possible hemorrhage, okay? What is red flag? Okay, saturation of, okay, very good. Saturation of pad, okay, 15 minutes, okay, less than 15 minutes, yes. This one is red flag, okay, this one is red flag already. Okay, you need to act fast for possible hemorrhage. Okay, and can you still remember the transition? Can you still remember the transition of your lochia? Anyone? Okay, can you still remember the transition of your lochia? Anyone? Can you still remember? Can you still remember the transition? Okay, how about the others? Okay, Okay, can you still remember your RSA? Okay, RSA. Okay, RSA stands for it's your rubra. Can you still remember that? Okay, afterwards, Serosa and then Alba. Don't worry, NCLEX will, okay, would ask you about this one, but yes, it's a good to know naman. It's a good to know, yes or no, okay? But our focus here is more on bleeding, okay? Saturation of pads or the pad, okay, is so less than 15 minutes. It's a red flag. Very good dudong. Okay, dudong, very good. Okay, the third one is your, can you still remember the third one? Okay, it's very important to assess, okay, for your thrombophlebitis. Yes or no? Yes, okay. All right, so management for your DVT. Okay, it's more on, very good, the DVT prevention. Okay, thrombophlebitis. Okay, your thrombophlebitis. Okay, assess for DVT. Very good. Okay? Like with blood clots, something like that. No? So we assess for deep vein thrombosis by checking for what? For unilateral calf pain and swelling. Yes or no? Yes. So it's very, very important to what? Always measure both calves and you need to compare that, no? And of course, like encourage early ambulation, avoid prolonged bed rest, and report, okay, any signs of what? Warm, redness, no? Or pain in one leg, okay? So that reflects to your DVT. Yes or no? Yes. All right. Okay. Sige. Again ha, just to make a recap. Okay, so we've discussed about the three big things to assess postpartum. Okay, very important ha. You cannot afford to miss this, the fundus. No, again, it should be firm, midline, and descend. Okay, it should be 1 centimeter per day. Okay? If it's boggy, massage it. Okay? As simple as that. Okay? In the lochia, saturation of pads, less than 15 minutes. Okay, that indicates hemorrhage. It's a red flag. Yes or no? DVT risk, uy ha, there is a unilateral swelling or pain. Yes. Okay. Also keep an eye. Okay. Keep an eye out for the postpartum depression, especially if mood changes last beyond 2 weeks. Yes or no? Yes. All right. Okay. Sige. Another one, I would like to highlight this now. Okay. So let's talk about of high risk in pregnancy. Okay. Actually, this one is a 30-minute. Okay. I don't know if you can finish, but yes. Okay. I will try to finish this. Okay. Yeah. So let's talk about of your pregnancy-induced hypertension, which is a trending topic. Okay. Your PIH or your pregnancy-induced hypertension, okay? So, teen, ha? Is this also the same as your gestational hypertension? Yes or no? Yes. And this condition occurs, okay, occurs after, okay, after 20 weeks AOG, okay, after 20 weeks AOG. Take note of this one, okay? Teen, what is the main problem here? In PIH. Okay, so aside from, yes, it can be an hereditary, yes, or you have an underlying condition, yes, okay, hormonal changes, yes, okay, yan. So there is what we call vasoconstriction. No? So there's vasoconstriction here. Vasoconstriction, yes or no? Yes, right? And the predisposing factors, yes, we mentioned earlier, but take note that younger, okay, younger individuals like actually younger than 20 years old and older than 40, or there's an advanced maternal age, no? So persons who are in low socioeconomic background because of lack of education, okay, they didn't know what to eat, diba? They consume high in sodium, right? Okay, right? So if NCLEX would ask you, okay, for the complication, that is your, okay, the complication of your PIH is your IUGR. IUGR, or commonly known as your intrauterine growth retardation. Intrauterine growth retardation. Okay, what else? Small for gestational age. Yes or no? Yes, take note of that one, ha. Okay, again, the major complication we worry about is your IUGR. Okay, so leading the babies, okay, ha, that are SGA or small for gestational age. Okay? Sige. Right. So let's talk about the types of your PIH. Okay? So most of the time, na pagbabaligtad. Okay? Yes. Okay, Tin, what are the differences between the PIH and preeclampsia? I don't know what are the differences. Okay, so let's answer that. Okay, let's answer that confusion. Okay, sige. So let's answer that. Okay, so we have here the types. Okay, the types of your PIH. Okay, so we have here your, okay, take note of this one. We have here your transient hypertension. Okay, your transient, okay, hypertension. Okay, next, we also have here your preeclampsia. Okay, your preeclampsia and your eclampsia. Take note of this one. And your eclampsia. Take note of this one. Right? So when we talk about of your transient, okay, your transient hypertension, teen, what is the problem here? What is the main problem in transient hypertension? Okay, just an increase in the blood pressure, as simple as that. Take note of that one. All right, so just high blood pressure, no protein in the urine, just increase in the blood pressure. Okay, the problem is BP. Okay, 140/90. So there's hypertension. BP is 140/90, or it can be 130/90. Yes, right? Next, we also have here your preeclampsia. Again, our problem here is, okay, just high blood pressure. Okay, right? Next, we have here your preeclampsia. Okay, again, what is the problem here? There is hypertension plus, okay, very good, plus proteinuria. Plus proteinuria. Okay, protein in the urine, and add this. There's also what? Edema. Okay, I would like to highlight what type of edema. Okay, so just to make a recap, okay, you already tackled, okay, in your antepartum, okay, the discomforts during pregnancy, the physiologic changes during pregnancy, right? Okay, so what is the normal? Okay, teen, is it normal to have an ankle edema? Yes, that's expected. So that's a discomfort or physiologic changes during pregnancy. Yes, okay. But what is the abnormal? All right. If you notice that the patient is having this face, okay, and hands, okay, okay, edema of the face and hands, uy, it's a red flag. Take note of that one. It's a red flag. Okay, so meaning, okay, preeclampsia is there's hypertension, proteinuria, and edema of face and hands. All right. So, Tin, how about the eclampsia? How about the eclampsia? So, there's hypertension on your eclampsia. Okay. What else? There's also proteinuria, and there's also edema. Okay, what type of edema, Tin? It's your face, it's your hands, and take note of this one, additional. Okay, we have here your cerebral edema. Okay, uy, the brain is already affected. Cerebral edema. Okay, cerebral, okay, edema. And what will happen if there is cerebral edema po? This one might progress to what? Okay, this one might progress to huy, seizures or convulsion. Very good. Okay, seizures. Okay, or convulsions. Okay, so that is why, okay, it's very important to watch out for this, right? NCLEX loves asking you to differentiate mild versus, okay, severe preeclampsia, teen. Okay, there are also types of preeclampsia. Yes, there's also type of your preeclampsia, Okay, so let's talk about of your preeclampsia, this one. Okay, so when we talk about of your preeclampsia, we have again, what are those again? Mild and severe preeclampsia. So, teen, what are the differences? Okay, if it's mild, okay, so mild and severe. Okay, so what are the parameters? What are the parameters? So we have here, okay, the blood pressure, we have here the proteinuria, and of course, okay, proteinuria, and of course, your edema. Very good. Okay, so let's talk about the edema and the weight gain. Uy, very important, the weight gain, It's very important that you know the norm. Okay, can you still remember the normal weight gain, okay, during pregnancy? Anyone? Can you still remember that? Can you still remember that? The normal weight gain during pregnancy. Okay, so let's have a recap. The normal weight gain during pregnancy is, okay, on the first trimester, it should be 1 pound. Okay, 1 pound per month. Okay, and during the second and third trimester, it should be what? 1 pound per week. 1 pound per week. Okay, so let's use this it's very important that you remember this now. Okay, so when we talk about of your types of pre-eclampsia. Okay, eclampsia. Okay, so we have the mild and severe. For the blood pressure, it's 140/90, considered as mild preeclampsia. Okay, it is severe if it's beyond 160. Okay, 160/110, right? Of course, we have here figures, the +1 and +2 for mild, okay? For your proteinuria and your edema, +1, +2, +1, +2, right? Okay. For your severe preeclampsia, yes, we're expecting a +3. Okay, for proteinuria and edema. Okay, +3, +4. Okay, +3 and +4. Sorry, +3 and +4. Okay, how about the weight gain? Take note of this one. Okay, so this is the normal weight gain. And take a look at the weight gain here in the mild preeclampsia. So we're expecting a more than 1 pound. Okay, a more than 1 pound per week, yes or no? So how about in the severe, it's more than 5 pounds. Okay, it's more than 5 pounds, okay, per week. Okay, so this is too much. Okay, and it's very important to monitor for elevated creatinine, liver enzyme, and of course, especially here in severe preeclampsia, no, signs of impending seizure. Yes or no? Yes. Okay. And of course, if NCLEX would ask you, what is the best position? What is the best? Oh, you cannot afford to miss this. A favorite of your NCLEX now. What is the best, position for patients with PIH? Anyone? Okay, what is the best position? Can you still remember? What is the best position for patients, okay, with PIH? Best position, anyone? Type your answers here in our chat box. Okay, so what is the best position? You can never go wrong selecting the left. Okay, left side lying, left lateral. Yes, most of the time is the correct answer, no? It's your left, okay, lateral. Okay, so let's add, okay, recumbent position. Okay, recumbent position po. Recumbent position. Okay, so what else? How about for the environment, no? So, okay, environment, okay, environment. It should be what? Wait, take note that the patient is at risk for seizure. So it should be, anything that reflects seizure precaution, right? It should be, yes, okay, quiet and dim. Okay, it should be quiet, calm, okay, quiet, okay, and dim. Okay, quiet and dim environment. Private room, yes. Okay, dim private room. Okay, very good, no? So, less stimulation, dark, no? Okay, because seizure precaution. Very good. How about for the company? Okay, rule of cohorting, same diagnosis, yes. The case of your patient is PIH. This one is more on the cardio, right? Okay, so the best company of this mother or this patient is a pre-eclamptic mother. Previous NCLEX question. A pre-eclamptic mother. Take note of this one, no? Or anything that reflects a cardiac problem, like a postpartum cardiac mother. Okay, a postpartum cardiac mother. Yes. Okay, that's rule of cohorting. And of course, if NCLEX would ask you for your priority, what is your priority here? Anything that reflects airway. Okay, anything that reflects airway, like for example, loosen the clothing, administer O2. Yes, okay, you can never go wrong selecting the ABC as your priority. Okay, loosen the clothing, administer O2. Yes, no, and of course, it's expected that the medical management would be hydralazine. Okay, hydralazine hydralazine. Okay, but take note of this one. What if, okay, there's already convulsion or at risk for convulsion or seizure. What is the drug of choice? Anyone? What is the drug of choice? Okay, to prevent convulsion. To prevent convulsion, the drug of choice to prevent convulsion. Anyone? Can you please type your answers here in our chat box? Okay, so what is the drug of choice to prevent convulsion? Okay, to prevent convulsion is very good, Arlene. That is your magnesium sulfate. Okay, this one is favorite of your NCLEX. You can never go wrong with this one to study. Okay, your magnesium, okay, sulfate. Okay, your magnesium sulfate. All right, so this one belongs to your category A. So meaning it's safe for the babies, yes. And before administering, okay, the magnesium sulfate, what parameters are you going to monitor? What parameters are you going to monitor? Can you still remember those three parameters? It's very important to what monitor for the RR, monitor for the patellar, okay, the patellar reflex, and the urine output of your patient, yes or no. Okay, do not give, okay, the magnesium sulfate if it's, the RR is, below the normal. Hi, what if the RR is 8? Hi, okay, so just give, okay, the magnesium sulfate if the RR is beyond, okay, more than 14, okay, if the RR is more than 14 breaths per minute, okay, more than, what's happening? Hold on. Okay, it's more than, okay, 14 breaths per minute. Okay, and of course for the patellar reflex, it should be, okay, plus 2. Urine output, okay, 30 ml per hour. 30 ml per hour. Because why? NCLEX loves to test about this one. There's toxicity. You should know the therapeutic level and the toxicity level. Yes or no? Yes. And of course, if there's a possible, all right, toxicity. For example, the RR is 8 na. 8 na. Okay, and the patellar reflex, there's hyporeflexia, a decrease in the urine output, okay? NCLEX might ask you what should be at the bedside. What should be at the bedside? So meaning, NCLEX is asking for the antidote. What is the antidote? What is the antidote? If NCLEX would ask you, what should be at the bedside? So meaning, asking for the antidote. What is the antidote for magnesium sulfate toxicity? Anyone? Anyone? Right? Okay, anyone? Type your answers here in our chat box. Type your answer here, okay, in our chat box, comment box. Right? Antidote? What is the antidote? Okay, antidote is, all right, starts with letter C. Okay, I think there's a bit of delay. Okay, my internet connection. Okay, I'm expecting a bit of delay. Okay, but I know you know the answer. Okay, what is the antidote for your magnesium sulfate toxicity? That is your, starts with letter C, your calcium gluconate. Very good, Duda. Okay, so that is your calcium gluconate. NCLEX loves to test about this one, no? When it comes to the medication, okay, the training medications are medications with toxicity level, okay, with therapeutic level and the toxicity level. If it's beyond that therapeutic level, okay, NCLEX will test your knowledge if you are a safe nurse. And of course, we are expecting that the long-term complication of this one is osteoporosis, okay? And for the diet, anything that reflects, diet, okay? So what is the diet for this patient, okay? What is the diet for this patient? Anyone? We're expecting that the diet would be what? Same as a diet for hypertensive clients or patients, right? Okay, DASH diet, okay? So this, okay, DASH dietary approach to stop hypertension, fruits and vegetables, wheat, cereals, bran, okay, something like that. And take note of this one, we never restrict sodium, okay? It should be, okay, a low to moderate sodium intake of about, it depends on the blood pressure of a patient, okay? It might range to, okay, 1,500 milligram, okay, to 2,000 milligram. Again, it depends on the order of the HSFP. Okay, but we never restrict the sodium intake. All right. Okay, so how are you guys? How's everyone doing today? All right. Okay. All right. Sige. And that, okay, wraps up our session for tonight. Okay, at the AMN Academy show. So I hope you were able to pick up, okay, the NCLEX key takeaways from the fetal heart rate, okay, right? Okay, fetal heart rate patterns, the decelerations, no, the labor stages, the postpartum priorities, no, and the critical management of high-risk pregnancies like your PIH, no. So always remember, it's not about memorizing everything, it's about understanding what matters and practicing the good clinical judgment, okay? So if you're aiming to become a USRN, take the next step and apply now at amnhealthcare.com/international. So that's where your US nursing journey begins, and AMN will guide you every step of the way. Okay, so again, thank you so much for joining me live. Do not forget to follow AMN Healthcare and IPOS Processing and share this video and tag your fellow future USRS. Okay, again, I'm Coach Teen, and this has been your AMN Academy show. Keep going, keep growing. Bye. I'll see you on your next NCLEX breakthrough. Okay, good night.